Welcome to Montgomery Smashing the Stigma, a podcast that shares stories about mental health and wellness and connects people with groups and solutions to help smash the stigma about getting help.
Hello, everyone. I'm Connie Gaylor. Welcome to the Smashing the Stigma podcast.
And I'm Amy Frederick. Joining us in this episode is Flynn with Solace. At one point, she was even a client.
Welcome, Ann. We appreciate you coming and speaking with us. So Ann Flynn is with Solace, and for our listeners who don't know, the city contracted with Solace in June of this year to offer mental health support and resources that anybody that calls in would be able to be matched with a care companion to find resources, especially in a crisis or even if not in a crisis. So, Ann, can you explain to our listeners exactly what Solace is?
Yes, Solace is a care coordination service that will do all of the steps to help find mental health treatment or substance abuse treatment. So we will work with any individual who calls or goes to the QR code. You can do an anonymous search on the web page from the QR code, find all the information yourself. At any time, you can then call a care companion to have them help do the extra work.
So it can be, they have a choice. They can independently search and do their own phone calls.
Yes.
Or they can choose for the assistance of a care companion.
Right, exactly.
So for anybody who's a little,
Hesitant.
scared and
Yes.
hesitant to really give out a lot of personal details, they can do this on their own.
Yes.
Okay.
And it's completely anonymous. So the city of Montgomery doesn't know who's doing it, what they're looking for, all of that. It's completely anonymous.
So let's walk through it. So say that I'm looking for a therapist. I call the number. What happens next?
If you call the number, you're going to immediately get to the screeners who will take some basic information from you. Then you will be connected to your own care companion. So then you and that person specifically will work through finding you help.
So how long, you said that you check back in with your clients, how long do you stay with someone?
As long as it takes to find them help. And then we'll check in. We check in, I can't remember the exact timing, but like the day after the appointment. And then we check in again, I think in 3 months to see how things are going.
So would there be an advantage for somebody to use a care companion versus trying to do it on their own? Is the care companion going to be more successful in getting an appointment sooner than if it's just an individual calling these different practitioners?
Well, I think the bottom line is that it could be the same.
Okay.
Except that the care companions are going to make all the phone calls. So you as a person may call 10, 20, 30 providers before you find someone that fits your criteria and has availability. Mm-hmm. So if you let them do it, they're just calling, okay. So they're going to make it go faster for that reason. And you're not carrying the burden of making those phone calls and keeping track of all that.
Right, because I can see how that would be overwhelming and somebody would just give up.
Yes, for sure.
Now, when we contracted with Solace, and I'm just saying this for the benefit of the listeners, the city actually provided a list of local providers, but Solace also does a lot of homework to come up with a very large number of resources.
Right. So we will take the providers that you gave us and try to use those first. Mm-hmm. And then if there's no availability or they don't fit the criteria, then we have a whole team of people finding all of the providers that are available and putting them into your zip codes.
Mm-hmm. So somebody calls, they talk to a care companion, you follow through with them. Then after 3 months, do you keep their data in your system to where if they call back?
Yes, they can call back anytime to try to get a different one.
Yeah. So,
yes.
Because maybe after 3 months, it still isn't working. It may take that long for somebody to feel connected or comfortable enough to really get into the depth of what their need is.
Yes.
So they can still call back in.
Yep.
Okay.
Yep.
I think that's valuable because, and sometimes people, we're all prone to kind of get to a point and think, oh, we're doing good. And then they back off only to find out, man, I need to get back in. So you would still have that information on file, so you could pick up where they left off.
Yes.
A care companion could still move forward with trying to find somebody different or reconnect them.
For sure.
Okay.
Yes.
But Ann, we would like to invite you, if you're comfortable, to share your story and to tell us how you came to know about Care Solace and eventually start working for Care Solace.
Yes. So to go back a little ways, I had been talking to a therapist through a divorce, all kinds of things. And I really relied on her a great deal. And then in the pandemic, she retired. So I didn't have anyone after that. And also during the pandemic, the person I had been working with stopped having clients. So I didn't have a job. Then a friend of mine that I had worked with in a different capacity was doing the marketing for Care Solace, and she needed to go on maternity leave. So she suggested me to them. So I started covering for her. It just all worked out really well. I really appreciate what Care Solace does. I liked the people that I worked with. So they offered me a job, and I ended up staying. So once I was at Care Solace, at the beginning we were way smaller than we are now. And so we didn't have specific processes in place for different things. But my youngest son was really, really struggling with his mental health. So he was supposed to graduate high school in 2020. He already had trouble with school, had been doing like homeschooling that just wasn't good. So he was really, really struggling. And so he asked me if we could find, because he had also been seeing the therapist that retired. And so he asked me if I would help him find a therapist. And it's just daunting. You sit down at your computer, what used to be the yellow pages, now you sit down at your computer and you look, and everybody looks the same. It's hard to tell, who takes your insurance, what availability do they have? It's just very, very daunting. And when you're in the place where you need help the most, I think you have the least amount of emotional resources or mental resources to do that. So here I am working for this company. So I asked them, can you help? And they said, of course. And so at the time, Kelly took on my case, took all of our information, and she found a whole list of people who take our insurance, who have availability. And she asked me if I would like her to call them for me. And I literally sat at my desk and cried. It was just such a relief to have someone helping me find help for my son. Because he kept saying, have you found anybody? Have you found anybody? And I just wasn't able to do it. So she was able to help us both find a therapist that just worked out really well for both of us, helped us through a lot of different things. And throughout my time working there, my daughter also has found a therapist using Care Solace. So I think the thing that Care Solace is the most helpful is that we do the legwork. So we make the phone calls, we find out if they take the insurance, and the person in need of help, the parent or the person themselves, doesn't have to worry about those details, which is to me, the hardest part.
I agree. And I think that takes so much of a burden, because when you're dealing with a child or yourself and you are in the midst of it, it's like you don't have the bandwidth to search and to find. And it's all those things of insurance. And what if you don't have the insurance, and what will they accept, as a non-payment, a sliding scale, things like that. And that is a lot. And if you're dealing with mental challenges on your own, you just can't even think that far.
You can't.
So to have somebody act on your behalf that's what it's all about.
Right. Definitely. And we definitely help people with private insurance, people with Medicaid or no insurance. We will try to find somebody who has a sliding scale. Mm-hmm. There are some people that do very inexpensive for people like that. So we try to help everyone.
So what was that time frame like from the moment you said, I need help, and someone at Care Solace said, here's what we can do? What was the time frame?
She probably had the initial list for me in a couple of days. Of course, that was 2020, 2021. So things were still kind of sketchy at that time.
Sure.
So it depends a lot on the providers and how many providers we can find, how much availability. So sometimes we're able to get people an appointment, like make the appointment for them within a couple of days. She found me a list of providers within a few days. And then probably within a week, I had my first, like, get to know you, see if it's a good fit appointment.
So they give you, so Care Solace provided you with a list. And then if you find somebody that's not a good fit, then you have another person you can choose from.
Yes, or you can ask the care companions to go back, like to start over again. So we do a check-in with the person who got care. So we check in with them and say, "How was your appointment? Like, are you happy with them?" There's like a thumbs up, thumbs down type of thing through text. And if they weren't happy with their appointment, then we will find them another provider.
Well, that's really helpful because I would think as a parent, and I'm not putting words in your mouth, but you probably felt frightened. And I would want somebody to help my child right now.
Yes.
Can you talk about what that felt like?
Oh, gosh. I've been in several situations like that where it's a desperate feeling because you don't know how to help and you don't know where to even get the help. So to have somebody, and I've sat on calls as the like senior level team, we every month shadow the care companions. And so I have sat on calls with the care companions, calling people to make appointments for them. And they just won't stop. So if they don't find somebody right away, but they stay in contact with the parent so that the parent doesn't feel alone. Like we want them to feel like they have a hand to hold through the whole process, which I know for me, in previous times before I knew about Care Solace, would have been so helpful because you can also just feel so alone. You don't know what to do or where to go.
If you've never known anybody that was in that situation, I would think that's really hard.
Right.
And then you're blindly picking out of a list of people in the phone book.
Exactly.
I would think that would be really scary.
Yeah. So I think just to have the care companion be there, even just as a voice on the other end of the phone to say, "I'm here to help you."
Yeah.
And as a care companion, you are obviously screening the calls, to kind of get a feel for what they're looking for.
Yes.
And I'm sure there's a process for you to know the best avenue because, there's so many different providers that specialize in so many different kinds of things. So the care companion is really doing the hard work, like Amy said, to
shrink the list.
To say, okay, this is who we would recommend based on your needs.
For sure. And they will take all of the different variables into account. So if you have a certain, the sex of the therapist or LGBTQ issues or a certain religion or certain languages, we will find someone that fits those criteria.
Do you feel like with what you went through, and when you talk to different therapists, do you still rely on Care Solace for that even now?
Yeah, if I was going to find a new therapist for myself, for sure, I would ask Care Solace for help. I personally think every person can benefit from talk therapy, and Care Solace is such a great resource to help with that.
No, I totally agree. And, so we started in June, and then I think we got a report like in July that we had, was it 257, I think, people that had subscribed within 1 month.
Right.
And the average was it 7 days? That by that point they'd had an appointment.
It may have been, yes.
It was something like that. So I'm saying that because there is, even though Anne may be saying this is what, the expected turnaround time is, it really was that quick for the people who utilize the service. So it's not just mouth service, it's the real deal.
Right.
And we really are, connecting people with resources. I wanted to touch on too that Care Solace isn't just connecting people for mental health resources. There's other things that you also, for social services, offer as well. Do you want to explain a little bit more about that?
Yes, so that's also based on different criteria when people call in, but we can help them find food resources or housing resources, that sort of thing, depending on their need and what their criteria fits.
Mm-hmm. And even though we may not think that's prevalent in our mind, maybe for the community we live in, there are resources there that are needed. Mm-hmm. And so we just want to make sure listeners know that it's more than just mental health resources, that we're there to try to serve all the needs of the people that call in.
Right. As well as, substance mm-hmm. abuse treatment. Yeah. And we're talking a lot about therapy, but mm-hmm. we also can help with inpatient treatment, like a lot of different forms of mm-hmm. psychiatric care or mental health care that's not just talk therapy. Sometimes it's even more daunting to try to find those things.
Right. How many states is Care Solace in?
38.
38 states. How many cities do you deal with? Do you know?
The cities, I think we're in about 30. We're in close to 900 school districts, mm-hmm. and then about 30 cities.
That's a lot of work. I mean, that's servicing a lot.
Yeah,
yes.
That's a very wide reach. Mm-hmm. And school districts especially, because, our kids are needing these resources. And I think sometimes school districts they may have counselors on hand, but those counselors are like guidance counselors sometimes and not talk therapy counselors type thing. So, while we have shared this information with Sycamore schools, mm-hmm. And I know you're in other districts, that's something that we want our listeners to know too, is that your reach is not just local government.
Right.
It's all around in different areas of the community. And,
yes.
And that's very valuable,
mm-hmm.
As a resource. What is something about Care Solace that you found just extremely personal for you that would maybe help benefit the listeners to think, okay, I'm comfortable now thinking about going to Care Solace? Is there something that stands out? Is it the compassion of the care companions? Is it that it's totally anonymous and you felt comfortable being matched? Because you're having to give some pretty personal details to be matched.
Right.
Was there something that kind of struck you?
Yeah, I think
individually.
I think the compassion is definitely part of it, because prior to working at Care Solace, my oldest son struggled with drug addiction, and not having anyone to talk to really help figure out how to deal with that was so isolating and so scary. And I have heard specific care companions working with people, and it brings me to tears, really, because I know what it's like to be on the other end of that phone and have somebody say, I'm going to help you. So the fact that they're willing and they're there to help people is really the part. And yes, everything is kept anonymous. You got a report saying how many people, but everything's anonymized. Right. So you don't get any personal information.
We get no names, no addresses, nothing like that.
Right. You just get a report to say that it is working, that mm-hmm. people are using it. So yeah, we definitely take all of that very seriously.
If somebody called at 2:00 in the morning,
somebody would be there.
Somebody would be there.
365 days a year. Okay. So that's really important too, because mm-hmm. sometimes the holidays are really hard for people. And,
agreed.
And you're not mm-hmm. going to call a therapist's office and get somebody at, midnight on Christmas Eve. Mm-hmm. But we would have somebody answer the phone and talk to you and take your information. Obviously, we couldn't get help right that minute, but we would at least, just having that person to me is really valuable.
Oh, I think you said that earlier. I think you said you could go it alone. But I think there's some comfort when you're faced with a challenge that you've never seen before. And I think having a voice on the other line that says, I'm understanding and let me help you. Mm-hmm. I think that goes further than anything. So if somebody's on the fence about dialing that number, what would you tell them about Care Solace?
Yeah, I would say just call, because you're going to get, it's not like a call center type of situation where every time you call in, you're going to get a different person that doesn't know your information. So once you talk to the screener and get a care companion assigned to you, that is going to be your person. So you will be able to text with them or call and talk to them. about we don't offer therapy or services ourselves, but you'll be able to call and ask questions about where things stand, what have they found, and they'll be in constant contact with you.
I think that's a huge comfort.
Yeah, I do too. I think that even if somebody calls at 2 o'clock in the morning and they're in crisis and it's a holiday, I don't know if they expect that they're going to be able to get with a therapist right away, but that care companion has the opportunity to talk that person down, and to calm them and to let them know.
The empathy,
yes,
and to say, I'm here to help you. I'll be here with you.
If you had somebody on the line and it sounded like an imminent situation, what would the process be for the care companion? And when I say imminent, I mean like danger to themselves or something like that.
They have a whole process to follow. So I know part of it is suggesting that they call 988, but there's also, we have different processes in place to alert other people if they're saying that they're going to harm someone else, or, we'll get the police involved at some point. Okay. So there are definite processes that they follow for that kind of thing.
Yeah, that's good to know, because I'm sure with all the school districts you're in and all the cities you're in, that you've had those phone calls like that. Mm-hmm. And I can imagine the responsibility the care companion feels for the person they're talking to. For me, I would think it'd be very personal. Mm-hmm. Like every time you get that call, that you're going to take it to heart, that you're going to do everything you can for that person. And if they're in crisis, then it has to be your call to do the right thing.
Right.
And that's a big responsibility.
Yes, for sure.
So that's good. And that's just another good point to make, that, you have somebody that's going to be with you from beginning through the process. Mm-hmm. You're not going to be handed off.
Right.
It's a personal relationship.
It is.
And these people care. Mm-hmm. They're called care companions for a reason, mm-hmm. right?
Yeah, and they're very empathetic, and they really want to help.
Yeah.
Is there anything that we should have asked that we haven't thought of asking you that you would like to say about Care Solace?
I would just suggest that if anybody feels like they could use help in any kind of way, to give it a try, because I think it will be really helpful and make it a much easier process.
We are going to have all the information for Care Solace, so we do have it on our website right now. So it's there for anybody who's listening. If they go to montgomeryohio.gov, we have a mental health initiative page, and all of Care Solace's information is there and accessible. But there is a number that they can call. And mm-hmm. do you want to give that number to the listeners?
Yep. They can call 888-515-7881.
And we hope that our listeners take advantage of this. This is a resource that the city's been very honored to be able to contract with Care Solace and to offer to the community. And we want people to take it.
Yes.
If there's a need, please use this resource.
Yeah, that's what we're there for.
Yeah. Well, thank you, Ann. We certainly appreciate you
joining
coming
us.
Yeah,
thank you for having me.
Thank you for listening. If you or a loved one are in a crisis and need immediate help, call or text the Suicide and Crisis Lifeline at 988.